Hey everyone, it's been a while, but we're back better than ever. Today we're going to be doing an internal medicine question that has to do with cardiovascular system. So let's get started. Alright, so we have a 67-year-old man. He goes to the clinic with progressive left calf pain when walking for the past 8 months. Medical history is significant for type 2 diabetes, hypertension, and hyperlipidemia. He has a 40-pack year smoking history. He notes that the pain begins when he walks 2 blocks and resolves within several minutes of rest. He denies any pain at rest. His vital signs are normal. Physical examination shows diminished dorsalis pedis pulse on the left and cool skin over the left foot. The ankle brachial index is 0.68 on the left, and he started on aspirin and high statin therapy, and he's counseled for smoking cessation. Which of the following is the most appropriate next step in management? So let's start from the bottom up and start with E. So beginning therapeutic anticoagulation. Now this might seem like a tempting option, but you have to remember you're dealing with peripheral artery disease and not like a DVT or a pulmonary embolism. So with peripheral artery disease, like the cause of this is an atherosclerotic plaque that's formed over time. For this kind of thing, you want to give antiplatelet medication like aspirin and statin, as you can see in the question. Anticoagulation is more for thrombosis, with your DVTs, your pulmonary embolisms, your arterial thrombosis. So that doesn't help treat PAD. Therefore, E isn't the correct answer. D, obtain CT angiography of the lower extremities. This could also be a potential answer. I could see how someone would choose this. However, in the question, we've already done the ABI, the ankle brachial index, and it's 0.68, indicating there is peripheral artery disease, causing claudication to the leg. There's not a lot of blood flow getting there because of a plaque. So CT isn't really necessary here because you've already done that and you know that there's a plaque there. So for the next thing, I'm going to do C and B together. So C, start Cilostazol therapy. This could be a potential answer and is one of the treatments for PAD. However, you want to do B first. You want to start a supervised exercise therapy program. So why do you want to do this? Do you want to give your patient medication right away? Or do you want to see if they do some sort of activity and it gets better without the medication? Obviously, you want to do the exercise instead of the medication because it's easier and they don't have to take it for the rest of their lives, correct? So B, when a patient starts to walk more, they improve collateral flow. So you have your artery, you have an atherosclerotic plaque inside. When you start to walk more and exercise more, there's collateral arteries that form and allow for bypass and more blood flow to the leg. So that really helps, and it's the first line therapy for peripheral artery disease. If that is not sufficient enough, then we go for C and we give Cilostazol, which is a PDE3 inhibitor. It helps inhibit platelet aggregation and causes vasodilation. So if your artery has a plaque, it vasodilates that artery, more blood gets through to the leg, and it helps improve. So you would want to do B. If B doesn't work, you'd do C. The correct answer, however, in this question is B. And last but not least, immediate endovascular revascularization. This is absolutely last resort. You don't want to do any, aggressive surgeries like revascularizing with a stent or bypass. You only do this when there's chances of ulcers forming, when you've done everything else and they're not working, when you've done the exercise therapy, when you've done the Cilostazol, and you've given the statin and the aspirin, and you counseled for smoking cessation, and it's still there, they're still symptomatic, that's when you do A. But in this situation, we're still in the beginning stages of the PAD. We don't want to go that severe yet. Thank you very much for watching, and I hope you learned something from this video. Give us a follow on our pages. Thanks.